the NESW, you guys who are social workers, you might be members of the NESW, but they also have like a blog on the back end that they um, put like billing updates and advocacy work that they're doing with the insurance companies. I really don't know a whole lot about this, just to be like totally honest. The NASW put out this statement that you can now use these codes. Licensed clinical social workers can now use these billing codes. These are the codes, new billing codes, the GO522, GO533, GO554. They're calling them like for digital mental health treatment services. Okay, so I've done a little bit of research on it. I don't know a lot about it. I'm going to talk to Annie and Donna to see if they know anything about it. They put this out that we can now use these codes for FDA approved DMHT devices. Okay, now you guys know I'm into AI. And I don't know how this is all going to play in, but it's super interesting to me that the NASW is saying we can use these codes and bill if we're using these devices with our clients. I'm super curious, like, you know, HIPAA compliant ChatGPT using berries. You guys probably know I'm the clinical product consultant for Berries, which is an AI progress notes company, BERRIES.ICU/therapist. If you use the code 50 from Kim, you get $50 off the first month. So I'm just going to put that in here. That's an AI progress note writing platform that you can use. So they're amazing. Like I said, I'm the consultant for product development, and I'm helping them make it like perfect for therapists because I love AI. And of course, I hate writing progress notes and treatment plans. We're really building this cool product for everybody. So that's there to use if you want to go check out Berries. Anyway, what I was saying is it seems interesting to me that these codes are coming out. So GO552 covers the cost of the DMHT device and the initial education and onboarding per treatment course. So FDA approved devices, these are just a few. I Googled this. I've been looking it up, trying to research it. There's a long list of these, which really surprised me. There's one called Rejoin. There's something called Daylight RX, Spark RX. Rejoin, for example, is a prescription smartphone app designed for adults age 22 and above with major depressive disorder, especially those not fully responding to antidepressants. Daylight RX, digital therapeutic for generalized anxiety disorder in patients age 22 and older, teaching techniques to reduce worry and anxiety. So this is the fear, right? With like AI and all this coming on, that one day we're going to be obsolete because we're going to have all these AI tools that are like offering good like CBT stuff. But this is saying that using these FDA approved DMHT devices, you can bill for these. So, this is what I'm always talking about with AI. Like, how can we incorporate AI into what we're doing with our clients so we don't become obsolete? So they are on board with us using AI, because I just read a study recently that like 75% of people under 22 are using AI for everything. And this was like a university study, like they're writing papers, they're doing all kinds of stuff with it. So even universities are having to adapt. Like, how are we going to accept this? How do we allow this to be incorporated into original thought and grading papers and giving grades and all that stuff? So it's changing the landscape of everything. But these things, if you go read about them, they are AI in the background. So it's like, generalized anxiety disorders, right? Teaching techniques to reduce anxiety and worry. They're scoring themselves if they're using these tools. And the AI is saying, okay, you're not improving with this technique. Let me think. Let's use this other tool, and it'll give them another tool or way to improve their anxiety disorder. So these things are coming. So I just think it's super interesting that the NASW is on board and saying we can bill for it. So back to the billing codes, the GO522, the GO533 accounts for the first 20 minutes of monthly treatment management services related to the DMHT device, including reviewing patient data and at least one interaction with the patient or caregiver. So to me, what this means, and take it with a grain of salt. And of course, don't just start billing these saying, well, Kim said I could do this, because I want you to do your own research, of course. Reviewing patient data. So it's like your client comes in, the first 20 minutes of a session, they're going to say, hey, I've been using that, Daylight RX app. Here's what the last month looked like. Here's my data. Here's the things I was doing. Here's what worked. Here's what didn't work. Then you as the clinician can come in and build upon that. But you can bill for this, is what this is saying. And then Spark RX is another one, a mobile app-based digital therapeutic aimed at treating depression in adolescents. Oh, this should be spaced. Okay, so action steps. So this is kind of like what I've been researching. And again, this is just the NASW saying that we can bill for these. And it doesn't mean you're actually going to get paid for them. Because NASW also said that you could bill for two 90834s. They advocated for that with the insurance companies, but not all insurance companies recognize that or pay for it. So action steps, stay informed, familiarize yourself with these new billing codes and the type of DMHT devices available. Literally Google FDA approved DMHT devices. There's like a list of 20 of them that I found. Integrate thoughtfully. Consider how these digital tools can implement your current treatment plans to enhance patient care. Verify with the insurers. So this is key, right? We need to always check with specific insurance plans to confirm coverage and reimbursement rates for the services we provided. It's not going to matter. You might bill for it and they just don't pay it. They just say $0, or, who knows? So how to bill, okay? You must use an FDA-approved DMHT device. This is based on the research I did. Must be part of a clinically appropriate treatment plan complementing traditional therapy. So you need this in your treatment plans. If you're going to be using one of these, you need to have like a goal, an objective, anxiety. You've got the diagnosis, anxiety, and I'm using, this specific Daylight RX with my client to reduce anxiety, and you have to be specific and measurable in your goals always with your treatment plans. But having this written into your treatment plans is probably going to be key if anybody were ever to come back and audit you using these codes. Here's some examples for the GO522. Cost of the device, subscription or licensing fee for the digital tool, the time spent onboarding your client to use the device, and this is billed once per treatment course. So I'm not even sure what that means. That is so ambiguous. Per treatment course, does that mean you can only do it once, which I would think, with a client, if you've taught them how to use it once and you've onboarded them and you paid the subscription fee, you're done. So you can only bill it one, like per course of treatment with the client is what I'm thinking about this one. The GO53553 bill for first 20 minutes per month of reviewing data from this device. So that tells me once a month you can bill this, right? At least one interaction, phone call, telehealth, or in person with the client or caregiver to discuss the device's use and progress. Okay, so that's 20 minutes. There's no pricing here, right? So you have to decide, how much am I going to bill? How much is 20 minutes of my time? Is it 20 minutes out of 60 that I'm going to use this new amount added on to what I would usually bill? I don't know. I don't know how we do that, but maybe Annie and I could talk about it at the next billers meeting. GO554. If you spend more than 20 minutes in a month on these activities, you can bill for additional increments of 20 minutes. Examples, use cases. If you prescribe an app like Rejoin for a client with depression, you might help them set it up and teach them how to do it. You might monitor their progress using app-generated data to follow up and discuss changes, GO553. You might spend more time reviewing data or troubleshooting issues needed, GO554. Why can it be billed? These codes are designed to compensate for the time and effort spent integrating and managing these digital tools into your therapeutic approach. The therapist's role is just not providing the app, but also actively using it to guide therapy and challenges therapists might face. Obviously, insurance coverage, device availability. You can only bill for approved devices. You will also need to research what's available and clinically effective. I'm assuming if they're FDA approved, then they are clinically effective, but who am I to say? The insurance companies decide what's evidence-based and what's acceptable and what's not. Workflow adjustments. Therapists will need to integrate monitoring and follow up into their routines, which may require additional time and administrative effort, right? You're going to have to figure out, how am I going to do this? How am I going to have a consent for this? How am I going to work this into the workflow? Am I going to add 20 minutes onto a session so I can add this extra billing code into my billing on the claim form? So that's what I know so far. And let me stop sharing my screen and come back. That's all I know. Of course, I'm trying to keep up to date with this stuff and keep you guys up to date with it, with what's happening. I've got my document that I've compiled, but again, it's just my, interpretation of this so far. So I wanted to tell you guys about it, to let you know about it. It's probably something you could make extra money on. You know how I always talk about billing for more money. How do we do that? This is an example. If you're doing a regular 90837 and then you also add this code on the next claim line, I'm assuming that's how you bill it. On the next claim line, this GO522, add another $50 or whatever you think it's worth your time and energy to understand this device and interpret these results. Make sure it's in your treatment plan. Put it on the claim form, see what happens. My guidance is, of course, to call the insurance company first and say, hey, I heard about these new codes. Can I bill them? Can you add them to my contract and, make it available for me to bill? So that's what I'm thinking. If any of you guys try this, tell me, reach out to me. I want to hear more about it. I'm just super curious to see, if this thing gets paid, because I'm always looking for ways to add more money to what we're doing, right? So anyway, that's my little spiel for that.